Good evening. Welcome to Health and Overview Scrutiny meeting, 13th of July 2020 at 7 o'clock. As you know, this is a virtual meeting. Please may I remind members and those of you watching that any mobile devices, example Alexis, Google, Boxes, or mobile phone are switched off. If you are not currently speaking or being asked to speak, please mute your microphones. If you do not mute your mic, it will be muted for you. To assist people viewing the meeting, could everyone turn off their cameras and only turn them on when asked to speak? If you have a background selected on Microsoft Teams, please do not move around too much to avoid blending into the background. Also like to remind not to use the meeting chat function on Teams. Now I'd like to introduce the members of the committee and those supporting the meeting. Madeline Shopland, Matt Pope, Charles Maggett, Graham Ebers, and Jim Stockley and Nick Derman from HealthWatch. I would please note that the meeting will be webcast and will also be available to view online at a later date. Now I'm going to go to Madeline, please, agenda number 5. Is there any apologies?
Yes, Councillor Mile. He is being substituted tonight by Councillor Richards.
Thank you, Madeline. So Richard, thank you for joining us.
Welcome.
Right. Agenda number 6, any declaration of interest? Seem to be no one. No? Right.
Sorry, Abdul. Should I mention here that my father-in-law is in a Wokingham care home, given that care homes obviously are going to be featuring in the discussion?
Yes, you could declare that if you wish to declare that as a personal interest.
Okay, that's fine. Thank you. I will declare that as a personal interest. Thank you.
Thank you for that. Right. Shall we move on to agenda item 7? Is there any public question?
There is a question from Mr. Lloyd, which was submitted after the agenda.
Right. So can we... Tony, would you like to ask your question?
Tony, you're still muted.
Oh. Good evening, Tony. Would you like to ask your question? Oh, we can't hear anything. Madeline, do you want to? Sorry, I cannot hear his question.
Lloyd, you're still muted.
We can't hear you, Mr. Lloyd. Do you want to come out of the meeting and come in again?
No, I can't hear him. Can anybody else hear him?
Sorry, Chairman, I can't, but I wondered, could somebody else read the question on behalf of Tony?
I'll read the question, Chair.
Yeah.
So the question from Mr. Lloyd was, what do councillors feel has been the impact of the ban on visiting care homes on the residents, staff and relatives, and have there been examples of exemplary practice that should be encouraged in the future?
Thank you for that, Madeline, for reading that. Matt, do you want to take the question?
Yes, I'm happy to take that question. Can everyone hear me? Okay.
Yes, I can.
You're good, Matt.
Okay, good. Tony, sorry we can't hear you. And apologies for not giving a written answer. You'll have one shortly after the meeting. But yes, I mean, this has been a really difficult time, not being able to visit in care homes for friends, relatives and staff. And it's been really tough. I mean, what we have learned, though, through this period is that restriction of movement in and out of care homes has been a really important factor in terms of controlling the spread of the virus. So although that's been a really difficult sacrifice for people to make, it's been a really important measure as part of infection control. But there have been some good practice, especially now as things are beginning to open up a bit more. The use of technology, care homes have worked really hard to use technology to have video calls and the like with residents, window visits. I think people have seen a lot of that in the media. Special rooms, entrances through different entrances, garden visits, all of those things have been, there's been some really good levels of innovation in our care homes. They've gone really hard, worked really hard to try and not keep the isolation going as long as possible. And one of the things we're doing at the moment is working really hard with our task force and care homes to gather up those safe visiting and different ways of visiting and getting contact methods, and we're putting them currently into a guidance, which I've seen a draft of this morning, which is actually hopefully going to go out a bit later to care homes to give them some more advice. Because one of the things we don't have is any government guidance on safe visiting, which we're still waiting for, but we know it's a really important issue to address. So can give you a full written answer, and we'll get that to you after, but hopefully verbally that answers your question and kind of reassures you as to where the position is currently.
Thank you.
There we go. I can hear you now.
And now we can hear you, Tony.
Excellent. Am I allowed to follow up?
Yes, go ahead, Tony.
Yeah.
I wondered whether councillors would consider some form of recognition of the heroism of some of the staff and GPs in the early stages of this outbreak.
Do you want me to answer that, Abdul?
Please go ahead.
Please answer it, Abdul.
Charles,
or let Charles, but I would support that.
All right, thank you for that. Charles, if you could go ahead, he mentioned councillors as well, so you will be the right person.
Tony, good evening. Yes, I absolutely agree with you. Basically, there are people, staff who work in these care homes who've gone above and beyond the call of duty and have been put in a really, really difficult position. So that's something we're actively discussing at the moment as what the best way to actually recognise that is, but fully agreed.
Thank you very much.
Thank you, Tony.
Thank you. Right. Thank you very much for your answers. I've seen someone raising hand. Is that Clive?
No, the hand's down now, Chairman.
Oh, all right. Thank you very much indeed. Okay. We're going to go to the next agenda item 8. Is there a member's question?
No questions.
Thank you. Right. Now we're going to move into item 9, which is the major item in our agenda. Right. Before we go into that, I just would like to echo some of the staff, which is members, that purpose of this item is for the committee to show the scrutinize of the council response to COVID-19 pandemic with regards to care home in more detail. Also like to remind members that the Management Scrutiny Committee agreed at their 24th of June meeting the following key line of inquiry that members may wish to plan their scrutiny around, that is timeline of response, funding and financial stability, PPE, how the sector will hold up going forward, what support is needed, and what will the sector look like. So I'm going to ask Matt Pope for the presentation now. Would you like to go ahead and do your presentation, Matt?
Thank you, Chairman. I'm standing in on behalf of Susan Parsonage, as I'm the Council's Deputy Chief Executive. Susan's away this week, so I would like to say a few words by way of introduction, if that's okay with you.
By all means, please go ahead, Graham. Thank you for joining us.
Okay, thank you. What I would like to say from my perspective when I say my perspective, that's I work alongside Susan as the co or alternate chairs of the Gold and the council's staffing response. What I would first like to say in terms of my experience of what's played out over the past months, incredible in terms of the pressures, the circumstances in which people have had to respond to ever-changing, high-intense, high-pressurized environment. I would first like to really make it clear that we really appreciate the huge amount of work that the care homes have done and how well they've worked with our council team, in particularly Matt and his team. I know in the press, of course, and all the media coverage, the focus was on the NHS, and I understand that. But actually, the care providers have been very much at that front line, pretty much from the get-go, and have obviously felt the full brunt of that. So I just want to put it on record that it's immense, the pressures that, some of these are quite small and more locally run care providers, and the pressures that they've had to bear with and respond to the most difficult of circumstances have been immense. Alongside that, I really would like to strongly give my sentiments of sadness and our thoughts from the council staffing perspective are with those really the painful deaths, and some of those were felt much more starkly in our care providers in some of the care settings than others. But regardless, even if the numbers weren't high, the fear and the imminent impact was always there. But sadly, some of the care providers did have some quite significant spikes in the deaths. So I think it's, of course, we're here as Scrutiny Committee to understand what's happened, to learn and see are there better ways forward, and we wholly accept that's a really healthy thing for us to do. But I think it's really worth undertaking that scrutiny in the backdrop of some of these broader contexts. What I'd also like to add is I think the work that Matt has done and his team in terms of the really high level and agile, proactive recognition of the need to support the care homes really early on. I mean, I don't know whether it'll come out on your time logs, but I know that on Good Friday, Easter, well before this become a big national spotlight, Matt and his team were ringing up the care home providers saying, is there anything we can do to help and support? So I think the council staff is response. The fact that we had 100 staff, I'm not saying they all went to care home support, but 100 staff at one time across the council were redeployed from other types of work, recognising that we as a council knew this was the highest, most pressing priority, and therefore they should stop what they're currently doing in order to attend to this. So I think throughout our crisis response, we've very early recognised this is a really important area, and that's rightly, it's such an important area for you to scrutinise. And we responded, I'm not saying perfectly, but we responded as well as we could at the time. I also want to impart to you all how complicated all of this is. It's not simply a case of care providers. It's not simply a case of adult social care and care providers. It's a whole complex system whereby the authorities, the responsibilities are not always what you think they are. And certainly the council's power to enact direct control is not present in many circumstances. At best, we can only provide mutual aid and support, which has very much been the approach Matt's taken, but he can't direct and insist. And of course, care providers, adult social care, the NHS, the BHFT, all of the health mechanisms, they are just three large components of a system, which of course involves other players in the system as well. So I think it's important that Scrutiny narrow down the focus where they can to the most productive for this council, because of course in looking at all of this system, it can be extremely broad, and it's not that we can't learn things, but our influence is obviously diminished the more we move outside of those things that the council can directly enact or even influence strongly. So I think I'll probably just end there and say just that the care providers and the support to the care providers has been one of the #1 issues at our gold response, which meets on a daily basis and actually met 2 or 3 times a day to begin with, and just reinforce my thanks to the huge amount of work that the council staff undertook, which included a lot of redeployed staff, but probably more relevant and pertinent for this meeting is the care providers, and what an amazing job they did, echoing the response to the question earlier on. What an amazing job they did in really, really difficult circumstances. So thank you, Chairman. I'll now hand you over to Matt.
Thank you, Graham.
Yeah, thank you, Graham. Completely agree with those words from Graham. So thank you. Chairman, how do you want me to proceed? I produced a presentation and sent it around. Do you want me to present that now and walk through that and then take questions, or?
I think that'll be best. Yeah.
Okay. So just if everyone can just bear with me while I shall I try and share my screen so everyone can see the presentation?
That will be great.
Well, it will be if I can get it to work. How does that look?
Oh, can't see anything.
Give it a second.
I can see it.
Yes.
What is care home on the screen?
Yeah, I can see it.
Yeah.
Good.
Oh, thank you.
Thank you, everybody.
Thank you.
Okay, so I'll just run through the presentation. I guess what we're I had a meeting with the chair and the vice chair, and what we discussed trying to accomplish in the time today is me going through these slides and giving everyone a kind of general overview of care homes, the situation in care homes and COVID, how they affected them, and what the council response to that was. So it's not supposed to be at this stage a detailed report. It just will give everybody a kind of information, an overview of the situation with care homes, and then we'll take some questions, and then it will allow the committee to think about its key lines of inquiry going forward over further sessions that we will have going forward over the summer and into the autumn. I think that's the plan. So I'll start because there are quite a few slides to get through. First things first. What is a care home? So put very simply, a care home tends to be registered for either residential or nursing home, and some nursing care, and some care homes are kind of dual registered with that. But it's just important to understand there is quite a difference between the level of needs in someone who's in a residential care home to someone in a nursing care home who has obviously much greater need and needs different sort of care. Also, some homes in our borough are registered for a specific care need. So They could be residential, they could be nursing, but they could be for specifically for dementia or dementia nursing or learning disability. And most care homes in the borough are run by private organisation or voluntary sector providers. Wokingham has a relatively large number of care homes, 52 in total. So you can imagine the effort to support care homes and the work that they had to do through COVID was pretty intense for a relatively small borough. As you can see, 33 in Reading and 46 in West Berkshire. Care homes, though, in Wokingham have a very good CQC, Care Quality Commission, rating. So 95% of our care homes, those 52 care homes, are rated good or outstanding. And that's a testament to the quality of the care that they provide in the borough. We have just one care home that is run through Optalis. So that's the council-owned company. And all the others are with private or voluntary sector organisations. And those 52 care homes are split up between 23 care homes for older people and 28, usually smaller care homes for people with a learning disability. And just to give you a kind of sense of scale, that's 1,352 care home beds in Wokingham Borough. I touched on this before, but it is quite important to kind of understand that with so many homes and so many different providers, that gives a kind of complexity in itself. And that was something that we've had to deal with through the pandemic, working with lots of different providers, getting information out, that sort of thing. And homes are very autonomous from the council. They are registered and inspected by the Care Quality Commission. The council places people in them, but they are independent entities in themselves with their own staff, policy and governance. And social care and NHS teams tend to go by invitation or referral or part of their natural working pattern. So yeah, care homes are monitored by the CQC, who hold them to account, including prevention and control of infections and related guidance. So all of that is done by a central government body, the Care Quality Commission. Care homes accommodate both WBC funded and self-funded clients or residents across the borough. And to give you a sense of how that works, about 25% Wokingham Borough Council funded and then 75% other is a kind of rule of thumb across the borough. Also, care homes come in all shapes and sizes, and certainly one of the things we learned through this period is the layout of a building, the ability to separate bits of the building out, was actually quite a factor in whether you can contain an outbreak, or it was more difficult to do that in a larger kind of open plan kind of environment. I'm not sure I'm going to run through this one by one or bit by bit, but I think it's useful to kind of establish a chronology. These have been crazy times for all of us, and it's difficult to remember kind of what happened when through a timeline. So I provided a kind of high level timeline, and we'll do more detail as we go on so that people can kind of remember kind of what happened when. But I'll just step it through quite at a high level. So important in the care home market, around about the 19th of March, the government released some hospital discharge guidance, and that was for the speedy discharge of people from hospital, and that could be into a care home. And that was around about the time when there was a lot of fear that hospitals would be overwhelmed with cases, if you can remember. Testing has been an issue all the way through. I'll talk about that in a minute. But routine testing out of hospital didn't come for about a month later. And then that's where some of the position or some of the difficulties that homes were getting into we became aware of. And at that point, we took some action. We set up our own task force and protocol. We took a position not to take people not tested out of hospital into care homes while we helped manage that situation. And then it wasn't until a bit later that the government released guidance that supported that. And we were asked to provide a care home support plan for the borough towards the end of May. So that just kind of gives a kind of timeline, or a kind of overarching timeline between the kind of beginning of the pandemic up to quite recently. Now I'm going to talk about deaths in care homes and some of the data around that and how to kind of understand some of that data. Now, we publish a data pack on the website every Friday. And as part of that, we publish information around our care homes. Now, deaths in care homes, you might think that as director at the council, I would get sight of that information before anyone else does. But actually, the ONS publishes this data on a Tuesday, and I get to see it at exactly the same time as anyone else. Any intelligence that I have about what's going on in care homes, I get through my staff working closely with those care homes. I don't get official notifications before it gets put out in public. And there are a number of different ways to look at deaths in care homes. So this here is the ONS data in terms of COVID-19 deaths in care homes. Now, there needs to be some maybe skepticism around some of this data, in that this is death certificate data where COVID is mentioned on the death certificate. That could be variable across different parts of the country or between doctor surgeries, etc. So you have to look at it with through that lens. But the way that's presented here is the table at the top right gives the overall numbers, and this information is up to including the 19th of June. There's more up-to-date data as it comes out each week, and then we present it as a rate in Wokingham of deaths per 1,000 care home beds also. So that kind of gives people an idea as a rate, because we've got quite a lot of care home beds in Wokingham. And as you can see, Wokingham here sits sort of in the middle there, and Bracknell and Slough have very small numbers of care homes. Personally, I think a better way of looking at COVID and its effect on death rates, not just care homes, but also across the wider population, is to look at something called all-cause mortality. So looking at how many people are actually dying, and in a minute I'll show you a slide where it compares overall deaths, all deaths, against a kind of normal rate for this time of year. So this slide here looks at all-cause mortality in care homes, and then it produces that as a rate per 1,000 care homes. And as you can see, there's a bit of information on there. And Wokingham there has a lower rate than Windsor, Slough, Reading, and West Berkshire, as you can see in the bar chart on the bottom right of that slide. So this here is a graph, and this is in care homes, but we also produce this data for all deaths in the borough, and this is all-cause mortality in care homes. Now the little red line is what would be a kind of average rate for the last 4 or 5 years, death rate per 1,000 care home bed in Wokingham, and the blue is what has happened with deaths since the beginning of the year. So you can see, unfortunately, these haven't got the dates on them. These are week numbers, but your week 16, 17 is around about the time of the Easter bank holiday weekend. And as you can see, that death rate has dropped and is now actually much lower than the normal. going forward. We've got another week or 2 weeks data just out, and it looks very similar to week 25. It's below the normal death rate for the borough. I'm going to talk now about some of the challenges that our care homes have faced. I talked about this before. Hospital discharge. Again, the government guidance said that there didn't need to be testing out of hospital, and that didn't come into mid-April, when actually the guidance around hospital discharge needing to be 2 hours and 7 days a week came out in mid-March. PPE, everybody will have seen a lot of this in the press. That was been really difficult for our care homes in a number of ways, and we can talk about that in more detail. But it was difficult to get the right PPE. There was a supply issue, and the NHS were prioritised over care homes at the beginning, and social care at the beginning of the pandemic. There was a lack of a centralised distribution, so it meant it was very difficult to get supply of PPE, particularly masks, at particular times through the pandemic. And also there was an awful lot of what I've called confusing and changing guidance issued across the period. I don't know if anyone's actually done a count, but there were like at the peak, there were sort of 2 or 3 different bits of guidance coming out every week. And if you think about 1,352 care home beds, 52 care homes, getting that information out, getting people to understand it, and it changing in terms of what is the correct use of PPE was a real problem for our care homes to deal with. Access to testing was and is an issue, although it's much better now. As I said before, it wasn't to mid-April that understanding negative, or whether somebody was negative positive coming into a care home was established. Testing of staff and residents, there were numbers of different routes to do that, so it was sometimes quite difficult to understand which was the best way to do it for care homes and advise them. We spent a lot of time trying to help and facilitate testing into our care homes. More recently, whole home testing has come into care homes, so that's really good. Now test kits are delivered to care homes and they're able to get testing. There are still issues with that, logistical issues, and also issues around the need to do regular testing and getting that going. That's happening. And also older people care homes were targeted for testing, but some of those other residential care homes that I talked about, specifically for people with learning disability, have had to wait longer for comprehensive testing. Now I'm going to talk a bit more about what we've done at the council and the Adult Social Care Department to help to support care homes through this sector. So we took a very proactive stance early on in the pandemic, and we have offered mutual aid and support, and have been ringing care homes very early on to try and help them understand, or try and get them what they needed when they needed it through this period. We've had an improved funding deal for our care homes. We contract with prepayments to support them with cash flow, plus ability for additional temporary funding. I'll talk a bit more about that in a minute. We've been one of the most proactive boroughs in terms of trying to purchase personal protective equipment and then get them out to care homes. Close to 400,000 pieces of PPE we've got out to our care homes across these months, as well as regular advice and guidance around financial sustainability and infection control, and many calls to our care homes across this period to support them and help them deal with some issues. Testing, like I said before, way before it was easy to get testing. We were getting staff registered early as we can, and getting staff tested to help them through. We also offered staff so that if staffing levels were dropping, we could put staff into homes and help support people. And then spiritual and emotional support. Many of our community groups have really stepped in there to support care homes that are particularly badly affected, and help with staff morale, because those staff have worked tirelessly, and it's been a really difficult time for those staff in those homes. One of the things we did, and we kind of took it upon ourselves to do this really, rather than waiting for the government guidance, was we set up a protocol and task force with health and social care colleagues locally to support care homes. So this is a kind of dedicated team to provide specialist intervention and help into our care homes to help the spread of infection. And this team has got to a place where they're very, very experienced in supporting care homes and getting the right support and advice to them, depending on where they are. And that task force has supported all our care homes in the borough. I won't go into too much detail, but it has a kind of 4-phase approach. It has a kind of prevention approach where it is constantly trying to contact care homes and understand what the situation is and what they need, and trying to get what they need before an outbreak occurs. Then there's a kind of triaging when an issue comes up. Then there's a kind of reaction. This is phase 3, where if there are a couple of cases, how do we make sure we can provide a kind of barrier to that care home, help them get over that and contain it as best they can. And then phase 4 is how we help that care home get over that period once they've come out the other side of an infection spread in that care home, and how we get them back to phase 1 in that task force. So that's the work. That's the work of the task force, and that's ongoing. And they've worked really, really hard through this period to help get the death rate down with our care homes and get the infection rate down. And as you saw, the death rate is right down. And as we stand, there's very little COVID, if at all, in care homes in the boroughs as we speak. And our job now is to keep on top of that and try and keep that low as possible. Another thing to talk about of note is certainly well after we set up our protocol and task force and were supporting our care homes, the Minister of State for Care wrote to every local authority on the 14th of May and said, you need to put together a plan to support your care homes. For us in Wokingham, that was a relatively easy task because we were already doing a lot of that stuff, and we put that plan together. It's on our website, and we submitted that on the 29th of May. Now we had that assured, and we've been highlighted as an area of good practice in Wokingham Borough. Just to give you a bit of stats on that, part of the way we're monitored on our ability to support our care homes against that plan is every care home fills in a questionnaire about where they are on a regular basis, and that's monitored by the Department of Health and Social Care, and it's monitored across the region and nationally. And I'm pleased to say, in the initial rankings, Wokingham Borough Council has come out in the top 10% of all councils in how it's supported its care home providers through this period. And as you can see, some of those stats there stack up quite nicely. I won't read them all one by one, but you can see that's and those are scores that our care homes have put in themselves. Very important for me as director to get that data and keep an eye on things as we go forward. Just want to talk about financial support to care homes. So we've done, apart from all our normal funding for care homes, There's been grants, and we've gone above and beyond to support our care homes financially through this difficult period, because it's been very challenging for them. Increased costs in PPE, vacancy levels, that sort of thing, have really challenged our providers, our care providers. So yeah, financial support through the COVID pandemic. We've had a sustainability fund that's paid out to homes that have needed it. There's been an infection control grant, which we've pushed out to every care home so that they're able to take additional infection control measures. And we have extended capacity in our markets, in care homes, reablement services and domiciliary care through this period. So there's enough capacity. That all totals up to about an additional £2.9 million of funding to our care homes. I suppose next steps and challenges. I mean, this is there are many of them, but I suppose the first one is, and I know it touches a bit on what Tony was saying around visiting. We've worked extremely hard, and our care providers have been through a really tough time to manage the infection and the death rate down. We must keep on top of this all the time. What we've learned is if you can detect things early, if you can get the right advice at the right time, it can make a real difference, and we need to keep on top of this. The task force at the council will continue, and will continue to support providers for the foreseeable future, care providers, but we also need to open that out to other care settings, extra care, day centres, all these other places where vulnerable people congregate, to make sure we're offering that best support we possibly can. We need to work hard to continue getting funding to our social care providers to help them with financial sustainability, and the infection control grant from government. There's another wave of that coming, which we need to make sure we get out to our care homes, and we work with them to spend that effectively. So I'm hoping that has given everyone. I'm just going to turn that off now. I think hopefully that's off. Hopefully that's given everyone. I know I've rushed through that a little bit, but it's given everyone a general kind of briefing as to where we are with care homes, and certainly more than happy to take questions, and I'm sure Charles would be too. I've raced through that, which has given him a good 20 minutes before his 8 o'clock deadline.
Thank you, Matt.
I hand back. Yes.
Thank you for your comprehensive, detailed slides. Much appreciated. I'm going to ask members, please use the hands up function if you wish to speak, and also remind you when you finish, please, once you finish, lower your hands. So I'm going to go straight to members. I can see quite a lot of hands being put up. So what I'm going to do, can I go through alphabetical order and ask each members if they have any question for Matt or anybody? So first of all, Rachel, can I come to you? Do you have a question for Matt or?
Yes, Matt. I'm just kind of comparing, how we fared in Wokingham with how other countries have fared in this. Now, I'm going to say up front that I think Wokingham has been extremely strong in supporting care homes through this very, very difficult time. And some of the initiatives that you had, for example, making sure that people were not discharged into care homes without having testing, must have saved lives. If I compare to, for example, Germany was testing people by February, and by the start of April, they were able to test 500,000 people per week. Now, they've got a larger population. They've got roughly 20 million people more than that, more than the UK. Do you feel that would have made, if we had that early testing and the same sort of volume of testing, would that have made a significant difference, do you feel, within Wokingham?
Matt?
Yeah, sure. I'm not really sure about the detail of things in Germany, but certainly earlier comprehensive testing would have helped. Absolutely.
Super, thank you.
Thank you, Rachel. Jenny, do you have any question for Charles or Matt?
No, I don't. Thank you.
Okay. Jim Freeman.
Hi.
Hi, Jim.
Hi there. Matt,
Oh, hi, Jim.
Firstly, I'd just like to echo the sentiments at the start of this. This is, as reported widely by central government, unprecedented. I think the guys have done absolutely brilliant. I think the decision on the 21st of April of actually stopping taking without testing actually saved lives. So well done on all of that. This is not so much a question as a request. I know that it's difficult to turn around and say we could have done things better, but unless the people that organised and worked on the front line overcome the reluctance to actually say we could have done things better, we're not going to learn. So, you know, it's an offer as well that if anybody is really concerned and they want to do it without going through named physical channels, I'm quite happy to act as an intermediary. But unless we learn, when this comes back again, as it will, we won't get better. So it's a request rather than anything else. And well done, everyone.
I completely agree. Thank you for your words, Jim, and I completely agree.
Thank you.
Thank you, Jim. Guy, grandson.
Thank you, Chair. Yeah, a couple of echoing again previous comments. I think Matt, you've done an absolute sterling job, as have your team. I think that being, as you said, the top 10 responses in the country, and I also think that the decision taken not lightly in April to basically not take patients without being tested was definitely the right one and definitely saved lives. I think it's also a testament the fact that although you've taken decisions centrally, it's been very much a local run aspect. It hasn't been run by a big central bureaucracy out of London, and the value of that and the value of being that much greater flexibility is definitely telling. And the care force is where my question's going from in this regard, because the care force I think is an absolutely fantastic idea. Can you give us an example of it, basically an action with, you don't need to name a care home, but as an example about what it did and how it reacted in there? And also, has any other local authority basically adopted the model that we are using in that regard?
I guess last question first. The protocol that we put together, so that's how the protocol that our task force follows, was adopted across the West of Berkshire. So Reading and West Berks adopted it soon after we put it together. And it's certainly been shared widely as a good practice example across the Southeast region. In terms of an action, well, there are many, and they're more. Most of the action of the task force is about giving very specific advice and being able to get bits of PPE to the right place at the right time very quickly, you know, from our central store. Or it could be things like advice around disposable mop heads and where to use them and what to do. You know, it can be very varied and also very detailed, because what we've learned is that kind of rigor it is effective. You know, it's really effective in controlling the spread of the infection.
Thank you. That's very, very enlightening.
Thank you.
Thank you, Guy. Can I come to Clive Jones? Do you have any questions?
Yes, I do. Thank you, Abdul. Just taking my hand down. So
yes, thank you.
The first thing that I want to say is that all of the Wokingham Borough Council staff have done an absolutely fantastic job in dealing with this COVID-19 pandemic. The 100 or so people who have been redeployed, the people that have worked out of St Crispin's School, all the people that have been helping with at the care homes. They really have done a great job, and I think that we as a committee really should recognise that. And I don't know how you do it, but I'm sure that Abdul, you can come up with a way that we can do this formally, or but I really think that that is important. I also want to say that an awful lot of people, more people, would have died if it hadn't have been for Matt and Susan coming up with this protocol at the end of April. And they really have to be thanked on behalf of those people who are still alive and their families, because it was a very difficult thing to do, to go against what the government were advising. What is missing from Matt's chronology is that on the 3rd of April, the government actually told us that we were not allowed to refuse anybody entry to any of our care homes, whether they had been tested or not. And all of the senior officers at the council, I think every single one of them, all of the leaders of the political parties were all horrified about that. And we contacted all of our local MPs, and it got, I think, well, it didn't get a response from the people in government that mattered. I know that John Redwood was very supportive. I know that Theresa May was very supportive, but they couldn't change the government's mind. And nothing changed their minds until really we had seen a spike here in Wokingham, and we had officers who were brave enough to say, enough is enough, we're not doing any more. And then a lot of other local authorities started to ask if they could see our protocol, and we spread it around, and then they changed their minds. But we certainly should not be underestimating what a big, significant thing this was that was done. And I would like to see more or less my word for word in the minutes, if you can, Madeline, because I think it's very, very important that all of those points are covered. I will come back to PPE and stuff like that, and I'm sure other people will have some questions. But whilst Charles is still here, and I think Matt will probably stay until the end of this, that I want to be absolutely sure that we have robust plans in place to deal with any second wave that might come along. And also, have we got robust plans in place for a second, not a second wave of COVID-19, but a second pandemic, which might be a bit of Ebola, might be a bit of COVID-19, and might be much more dangerous than the COVID-19, which is bad enough as it is.
Thank you, Clive. Shall we move on to...
Yes, thank you, Clive.
Thank you. Adrian.
Well, there was a question there, actually, at the end.
Oh.
Do we have robust plans in place?
Okay, I was going to ask.
The answer from Charles and from Matt is going to be yes, we do.
Yes, I did have this question towards the end, but you asked on my behalf, Clive, so we'll come towards the end. Yeah.
Would you like me to answer that, Abdul?
Yeah.
Yeah, go for it.
I mean,
okay.
This is the key concern. Firstly, Clive, I did want to pick up on a couple of things, basically. Firstly, that Matt said in his presentation, and secondly, that you touched upon there. And then I will answer your question, basically. I mean, Matt's talked about functionally how this all worked, and I agree with every single thing he said. What he's not talked about, basically, is the things we had to do to try and get attention to this, because the grave frustration for me in all of this was the whole systems that were meant to be helping us and meant to be supporting us just did not work. Yeah, we had to do a public appeal for PPE. We actually went into one bank holiday weekend on a Friday where I was 50% certain we were going to run out of PPE by the following Monday. We wrote to all our MPs continually asking them to help. In fairness, the responses I saw, John Redwood sent us 6 or 7 possible leads for PPE. James Sunderland around 3 or 4. I didn't see any from Theresa May, but they may very well have happened. We were able to get ourselves out of that hole because we stood on our feet and were proactive and tried to move forwards. And it was exactly the same when we came to the care home problem. The hospital problem. We lobbied the NHS repeatedly, got nothing, loose promises, basically, maybe tomorrow, maybe next week. Nothing happened. We went to the MPs, basically, again, they tried their best, nothing happened. The decision to stop discharges was taken because we had no other option. We had to do something and we had no other option at all. And then literally, I remember a day, probably 3 or 4 days after this happened, speaking to Matt on the phone and hearing the frustration in his voice because yet again, basically, nothing was happening. And, it was where I made the decision to talk to the Woking paper about it, to try and get some attention that we weren't going to go away and we weren't going to go quietly. And basically, we were going to keep on banging on until somebody bloody listened. Now, in answer to your question directly, this is the main thing we talk about at the moment, because COVID and the response is other departments in the council talk about recovery and they talk about moving forward. And this is something we're going to be living with for 6, 12 months, possibly longer. And it's about keeping the procedures as tight as possible in the care homes to make sure it can't get back in. And if it does get back in, it's stamped on straight away. And the other thing I would say is, if you haven't seen it, have a look at the COVID management plan that was published last week on the website, about 115 pages, but it details every scenario about what happens if we have an outbreak in X location, Y location, what the procedure is. And, I can't say what will happen in the future, but, we're determined to keep absolutely bang on this because we've worked so hard to get to this position. So that was it from me, Abdul. I didn't want to say anything else. I mean, Matt described everything else better than I could have done, but I thought it was important to fill in some of the bits on the other side.
Thank you, Matt. Adrian, go ahead.
Thanks.
Yeah, I don't want to completely reiterate all the comments, but because I think everybody's described the whole situation better than I could. But Matt and his team and the WBC colleagues, it's amazing what you've done for the residents, and we really appreciate that. I'm honestly so disappointed seeing in your deck that there were, I would say, out of your control PPE supply chain issues. This is very disappointing. I know through various communications that happened in April and May time, you and the colleagues were all desperately trying to get on top of these PPE issues, and really, the supply chain, the actual NHS supply chain, the larger supply chain, was just failing and not working. So my question really is, and perhaps this is a little bit of a reiteration of Clive's point, but is WBC building up stocks of PPE to really cope with, a second outbreak, for instance?
Matt, do you want to ask?
I can, yeah. The short answer to that is yes. We've spent an awful lot of money, council money, and we're lucky that we are a financially sustainable council and we can afford to create a stockpile. I also have links to other authorities in the region that have stockpiles also. So we do have PPE going forward. It's still an issue. The cost of it to our care homes, and the supply of certain types of masks is always an issue. The quality of PPE, that sort of thing. But we do have stockpiles. We're certainly not in a situation where earlier on in the pandemic.
If I can add to that briefly,
yes,
Adrian, just to, obviously, I don't think it was in Matt's presentation earlier, and please correct me, Matt, if it was, but we are the provider of last resort to care homes. They may be private institutions, but if they run out, we're the person, the people they come calling to. So we don't have to just look after ourselves, we have to look after every other person as well. Now, the other thing I was going to say is what Matt said is absolutely correct. We've been contacted by numerous people over the past month, 6 weeks, offering their services. I was had a phone call from on Friday, Rob Wilson, the former MP for Reading, who now seems to be acting as a representative, various SMEs who are selling tests, all kinds of stuff. And the answer was, no, we don't need anything at the moment, but we'll keep your details on file because for the past few months has taught us we never know when we might do. We hope we don't, but we never don't know when we might do.
Yeah, I would also like to say thanks to Charles actually for raising all these points with the MPs and everything else. And it sounds like Charles is working really, really hard, and we appreciate that. But one thing that I would like the HOSC actually to do is to challenge the parent organisations, the CCGs, the NHS trusts, and say, why did this supply chain fail? How can you improve this supply chain? How are you going to make this supply chain more resilient?
Agreed fully. And Adrian, you may have noticed the press release last week about when Tier 2 data was released, referred to not the first time we've been blindsided by national announcements and things happening which we don't know anything about. And Matt, I'm sure will not mind me sharing with you that when we were speaking probably twice a daily when this was at its worst about various things. And the great frustration he expressed to me repeatedly is hearing things announced on the TV or getting briefings, and that's the first he knows about it. I mean, I can't explain. Well, I just reiterate what I said earlier. The great frustration when these systems, they're meant to support you and are meant to help and so lamentably fail.
Thank you very much.
Thank you, Adrian. Barry Patman, do you have any questions for Charles or Matt? Barry? Madeline? Can Barry hear me?
I can see him.
Yes, I can hear you. I don't have anything further. My questions have already been asked. Yeah.
Thank you, Barry. Right, Malcolm Richard. Sorry for wait, but I know you've waited quite a lot.
Thank you, Chairman. I too wrote down a whole stack of questions and comments, most of which have actually already been raised and answered by the presentations. Just a couple of comments to make. Firstly, I think Matt's presentation was very clear and very informative and very interesting, so thank you for that. Also, Charles's details on the background to it and some of the hurdles he had to overcome and possibly still has to overcome and may have to overcome them again if it carries on. So that's keeping us informed there. Overall, I think we can be rather pleased, in fact, probably quite proud of ourselves in terms of what we did on that. Against the odds, we managed to pull through it. Officers, staff, members, volunteers, all those have all played a very important part. I think we're very grateful to those, and we are expressing them quite rightly. And the care homes as well, of course, should be in those. We're hopeful that there won't be a second wave, of course. We can never guarantee. It appears to be coming down well at the moment, and we've got a framework set up. So presumably, if it did come back again, we've got a framework that proved work before. We would hope to be able to go back to that. Is that an opinion, Charles or Matt, that it's still in operation, could be reactivated if necessary to full extent?
Do you want to go, Matt?
Yeah, I mean, the short answer to that is yes. I mean, we're not going to stand that down at all. We will keep going, certainly for the foreseeable future, all the way through the winter. Sure, for sure.
All I would add to that, Malcolm, is, the message has got to be at all times to all residents, remain watchful, follow the government's advice on washing hands and 2 metre distancing and all of those kind of things. And, if you've got relatives in care homes and you're going to see them, whilst it may be very hard, do what you're told to do, because basically there were very, very serious consequences of this, and we do not want it to happen again. If there's anything you can do to stop it.
I agree with that. And so the last point I was going to make then is that we're hopeful that we're on the decline of the numbers now, and we're heading back hopefully towards a more normal environment, whatever normal means post-COVID. But the important thing is we mustn't assume it's all over and it's perfectly safe and okay to not do things now. I think it really is quite important to act in exactly the same way, be alert, do everything just as if it was at a peak, because if you relax and think it's all gone, it can so easily return. So hopefully everybody will follow that advice, and all my other questions were answered by previous questions and answers. Thank you.
Absolutely agree, Malcolm.
Yes.
Sorry, Chairman. It's Graham Evers here. I just wanted to raise a point that aligns to what Malcolm said, his two statements. Absolutely right, we have to keep vigilant. But also in the initial statement, there was maybe the impression that we'd pulled through this. What I really want to strongly convey is this council is facing effectively three main streams constantly. One is the response to the crisis, which continues day to day and is still absorbing an awful lot of Matt's time and his team's time. We're dealing with the recovery, trying to bounce out of this in the best possible way that leaves the authorities' services and finances as intact as possible. And then there is in many parts of the council, including areas of Matt's, where the business as usual must be maintained. So I think it's important to stress that, because there are pressures that we are facing as a council all the time, yet our staff cohort remains at about 1,000, yet we've got these three constant pressures to juggle all the time, which is part of the caution that we would give around trying to contain the focus and the scope to make it most productive, from your perspectives, but also with the officers being able to deliver the information and the insight that's needed.
Chairman, please accept my apologies. It's Charles here, but I'm going to have to go because I've just had a message saying, where are you? So my apologies to members, and if anybody's got any questions they want to ask me directly, please feel free to email me or contact me.
Thank you, Charles.
Thank you.
Right. Thank you, Charles. Alison Swaddle. Alison, do you have any question?
Thank you, Abdul.
Thank you for waiting.
Of course, I want to echo the praise that we all have for everybody who's been protecting the lives of our residents in care homes and doing their very best to help them all. I'd also like to particularly praise the teams in Shoot End. I know that the team that provides PPE for the whole borough, they've been actually in their office every day going in and working very hard. I do have a question. I wanted to understand how often the care home staff are being tested for COVID. Is it once a week? Is it every 2 days? So I just wondered if you could tell me, Matt.
Thank you, Alison.
Yes, sure. Yeah. So it's an interesting question because last week it was announced that now that all care home staff and residents have been tested once, that residents will now be tested every 28 days and staff every week. And that's only just starting. So we'll see how the kind of logistics go around that. So from here going forward, staff will be tested every week. But certainly all the way through that timeline, initially there was no testing available. Then there was testing of staff who had symptoms only by self-referral or us referring them through. And then it moved to staff being able to be tested whether they've got symptoms or not as testing ramped up. And then that moved on to that first wave of blanket testing over the last, I think that was at the beginning, sort of mid-June, that sort of thing. So that's sort of where we are now. And it and the question still remains: well, could have that testing been rolled out a bit earlier?
So Matt, are we also testing that the members of the sorry about that noise, members of the care workers' family, so that we're reducing the risk to the residents in the care homes?
So when we test members of staff, we wouldn't test their I don't think their families are tested at the same time. But if there is a positive result, or if there's any worry about that, then the rest of the family can get tested as well. And that's been around for a while, So the testing was available to both key workers, so the members of staff, but also the people that they lived with.
Okay. Thank you.
Thank you, Alison, for your questions. All right. Before I can see there's 3 members putting their hands up. But before I come to you, that is probably Jim, Clive Jones, and Adrian. But before I come to you 3, I would like to give an opportunity for if Jim Stockley, Nick Derman, and Tony Lloyd, are you all there? And if you wish to ask any question before I go to our members again, do you have any question, any of you?
No question from me. This is Jim, by the way.
Thank you, Jim. How about Nick? Nick, do you have any question?
No questions from me at the moment.
Thank you. Tony?
Yes, please. The GP community is terrified of a flu epidemic occurring this year on top of COVID, and they're stressing very highly how important it is for everybody that can have a flu jab to have one. I wondered if there were any measures being taken to ensure that residents of care homes were given flu jabs as safely as possible.
Thank you, Tony. Matt?
Yeah, sure. So Tony's absolutely right. And I certainly promote wholesome uptake of the flu jab around the borough as we go into the flu season. In terms of exactly how that's been rolled out across our care homes, I think I'll take that away, Tony, and in my next meeting with my health colleagues, I'll raise that and see where we are with that, and maybe get back to the committee on that. I know that they'll be pushing it like they would do in a normal flu season, but it would be useful to do some specific monitoring of that. I think that's a good point. Thank you.
Thank you.
Thank you, Matt. Just quickly, conscious of the times, can we just quickly, Jim, you indicated you want to speak? Just make it fairly quick.
Just very quickly, it's a shame that Charles has left, but Matt, what I said earlier, please use this scrutiny as one of your support systems. Give us the opportunity to try to help with some of those frustrations that we sort of lightly touched on there. And I know Graham said there are things that we can manage, but through scrutiny, there are also things that we can actually highlight. So it's not only the ones we can manage within Wokingham, but the ones we can highlight as well. Please use us as a support system.
Thank you. Clive?
Yeah.
Clive, do you want to come back?
Yep. Thank you, Abdul. So we talked about tests and whether many of them are available. If there is a second spike and our 10 largest care homes all have somebody testing positive in them, will we have enough tests to test all of the staff and all of the patients in those homes?
So I think the answer to that is yes, because we are testing. We are now at the place where we're able to do whole home testing regularly. So all our care homes, all residents and all staff are getting tested have all been tested at least once, and now we're doing it regularly. So I'm more confident that if we had specific issues, we can call down on that capacity and get that done. Yeah. What I would say though is testing is really important, but it's what you do with the information you get from those tests, and then how you manage it in terms of infection control, which is equally as important. You have to have a plan around what your tests tell you, and that's a lot of the care homes have worked really closely with us to put those in place. It's the two things together: the information about where the virus is and what you're up against, and then what you're going to do about it. That's really important in a plan.
Okay, and have we had conversations with the care homes, bearing in mind most of them are private, about their finances? Because some of the homes where they've lost a few residents might actually be in financial difficulty. And have we started to consider how much extra we're going to be having to pay where we are fully supporting a resident in a care home? Because I'm sure that costs are going up, and I think what you did by paying a little bit more very early on and paying people up front was very, very, very sensible. Very good.
Well, Clive.
Well, there's quite a lot in that question, Clive. I guess we certainly are talking to our care homes quite a lot, and we have a sustainability fund where we have made payments around helping them get through this period, and we've done some kind of open book work, with care homes. What I would say, though, is Wokium's not alone in this. It will take those increased costs will be around for some time. Those lower occupancy levels will be around for some time. Could be 15 months, 18 months or so. What we desperately need is that longer term funding solution from central government. The money we've had to help providers has come in a short term lump, and we know this is going to go on, and it would be really useful for the council to have really clarity about that funding, for the short to medium term.
So we all need to be lobbying government to get.
Yeah, I knew Graham. I could just feel Graham wanting to come in. Here he comes.
Yeah, welcome, Graham. Go ahead.
Thank you, Chairman. Yeah, sorry to jump in. No. Yes, I think it's important that this committee and other committees are aware that the impact of COVID financially is not a single year only. And although the grant that we've received has been welcomed, it hasn't been anywhere near the financial impact, whether that's increased expenditure, loss of income, or inability to progress with our savings targets. I think the conversation about care providers is one of those whereby it's not going to be resolved. I think in a single year there will be a tail to this, and we have to walk that tightrope between trying to support our care providers in whatever way we can do, but it has to be in a very cost-effective way, because the council's finances are going to be impaired in a way it has never been, certainly in my lifetime as a CFO here. But the issue around care providers is right at the top of that agenda in terms of the longevity of the impact and making representations to government that we need, as Matt was saying, a fundamental review of the council's financial resourcing, and to have a long-term understanding of that to help with our planning going forward.
Thank you, Graham. Right. Clive, I need to move on.
I think you're on mute as well, Clive.
Yeah, well, we need to move on now. I'm giving the time. Is he still talking?
He is, yeah.
Adrian, do you want to take your very briefly, please? Then I'll.
Yeah, very quickly. It's a question to Matt. COVID is a very special time, but I want to check normal processes for DNR are not being changed. We have a case of a resident, which was at the RBH, actually, nothing to do with the care homes, where the DNR was changed without this person's knowledge and very much against this person's wishes. So could you check with the care homes whether normal DNR or do not resuscitate processes are in place? Thanks.
I will do that, definitely. Absolutely.
Well, thank you so much, Matt, for all the questions and answers you've given.
Abdul, is it okay if I just say just one thing very quickly, just to close off?
Yeah, can I just ask before Graham goes? I need to ask one question to Graham. Yeah.
Okay. All I would like to say, there's been some really kind words to me and my team tonight, and that's really, really appreciated. It's been a really difficult time for us, but I would just like to finish by saying, I'd like to put on record my personal thanks to those frontline workers in care homes. They have borne the brunt of this, and they have been absolutely fantastic. And I know this across the borough. There have been some wonderful stories about how people have managed and coped through this period. So I just want to say my thanks to them.
Matt, you just steal.
Totally agree.
Matt, you just steal my word. If I had every officer's, if you had every officer's name, 100 you deployed and spent 2.9 million. It's like from bottom of my head, I just want to say thank you to all them, your team and our senior management team at Woking Borough Council. Thank you so much. So now I'm going to go. Oh, I was going to ask a question to Graham.
Yes, ready for it, Abdul.
I know financially, I know you are in a very difficult situation, but Graham, I just want to thank you in this critical situation that you have managed to pass on 2.9 million and still you're working to get more grant on our behalf of residents. So I want to thank you for your work on that, please. Right.
Okay, thanks, Abdul. And I think it's really, I'd like to stress the importance of that's a reflection of the one team approach that we've taken to this. So the management team that you referenced previously, we've acted together, recognizing from the global perspective of what's important for the council. So the discussions with Matt and supporting Matt financially and otherwise has been an absolute imperative for us.
Thank you. Madeline, do you want to come in?
I was just saying that Nick has got his hand up to speak.
Oh,
and Clive, sorry.
Okay, so Clive, do you want to come in quickly? Clive?
Well, actually, you should take Nick first. He was before me. I'm quite happy to go after him.
Okay, Nick, thank you, Clive. That's very kind of you. Nick, go ahead, please.
Yeah, just a couple of things, and there's been lots of praise, and of course we echo that. But what I wanted to mention, which hasn't been mentioned so much, is the unprecedented collaboration between the council, NHS services, voluntary community sector, an unprecedented scale that we've never seen before with the CCG, things we would have liked to have seen before, but have suddenly exploded. And it's been amazing, and it's made a real difference. So I just wanted to mention that. The other thing I wanted to mention was, obviously one of Health Watch's statutory obligations is to carry out interim views in health provider settings and social care settings, and typically we've done that in care homes. But of course the challenge is, how do you do an interim view to hear the voice of service users in care homes and their families when you can't interim view? So I just wanted the council members to be aware of that. And I think it's probably something we need to talk to the council about. And Matt did talk about, guidance was coming out, but it's really, really important that we hear the personal experiences of the people who live in their care homes and their families.
I completely agree with that.
Thank you for your question, Nick. Much useful. All right, Clive.
Yeah, I'll be very, very quick. I'm sure the answer to this question is yes, but is there an updated plan for Woking Borough Council to take over the responsibility of any care home that might find itself going bust or being in financial difficulty?
That's probably the case all over the country, Clive.
Yeah, but I want to know that we've got an updated plan, and
Yeah,
as I say,
So-
I'm sure Matt's answer is going to be yes,
yeah. I mean,
but it
we
needs to be asked.
the answer is yes. We have provider failure plans. Whether that's not necessarily a kind of step in, hopefully, because we've got all of those conversations going, we'll help providers before it gets to that stage. But yes, we have updated provider failure plans, and you'll see on the corporate risk register, it's my number one risk currently.
Thank you very much.
Thank you, Clive. Right. Members, we had almost like 8:25 now, 8:13 approaching. We need to come to an agreement to note the presentation of the...
Sorry, may I just add something?
Yeah, go ahead, madam.
Obviously, you've had an introductory session on the council's response to care homes. So, if I could just ask members how you would like to proceed going forward. You've had the proposed key lines of inquiry from the Overview and Scrutiny Management Committee around, and obviously Matt's given you a good start today. Timeliness of response, funding and financial stability, PPE, and going forwards, and how the sector's going to look going forward. So the question for members, and obviously taking on board that obviously the pandemic is still ongoing, staff are still very busy, and need to take a bit of a break. How do you want to proceed going forward? Are there any particular individuals that you think that we should be asking? How would you like to group your meetings going forwards?
Thank you, Madil. Open to members.
I mean, from my perspective, hi, this is Adrian, but the meetings have been far too infrequent from my side, I would say. I wouldn't say we need monthly meetings, but every so many weeks, I think we need a meeting. We've got some big meaty topics to look into there. So, we will need some details, some briefings, and then we will need to be able to ask some questions about the content that's delivered to us. That's my personal view.
Thank you. Jim, you indicated to say something.
I think before we actually start meetings, I think we need to gather some data. We touched on some of the frustrations, some of the lessons we could possibly learn to help us go forward. So we need to try to find a way of gathering some of that data first.
Thank you. And Alison.
Yeah, I just wanted to, I think really it links into Jim's point, to say that, we need to get presentations and reports as much in advance as we can, so that, we've got time to read them, consider them, to sort of sources, so that we are able to ask what we need to know. We're all very busy as well. So if you receive something late in an afternoon and you've already got another meeting and then work all the next day, it's quite difficult to be able to, take it all in.
All right. Thank you. We'll make a note of that. Alison, Rachel?
Hiya. Yes, I was going to say it would be really good if we can agree up front some key topics that we want to focus on during the months ahead. And if I can just add to what Alison said, I normally stop work just before I come into this meeting, or in normal times I have to my commute finishes as I'm coming into the meeting, so I don't have any chance to see anything that comes in last minute at all.
Okay, thank you, Rachel. Anybody else indicated? Martin?
Yes, I have.
All right, go ahead, Clive.
Yeah.
Clive and Guy then.
Let's get rid of this. So I think I'm probably okay with questions for everybody about care homes. At the moment, don't need to revisit that, but may well do before the end of the year. But I think that we do need to ask some people from the Royal Berkshire Hospital to come and talk to us, and I'm sure we will have lots of questions for them. I want to know how they coped, how they think they will cope if there is a second spike or a second pandemic. I know that Overview and Scrutiny has got to be looking at things that have happened, but it's also got to be looking forward. But one of the things that has happened is there was clearly not enough PPE available in the hospitals, and I would want to be asking them why. I would want to know why. This is a anecdotal question that some of the senior people in the hospital were saying that doctors and nurses were the only people who were allowed to have PPE in March and the early part of April, which was meaning that a lot of cleaners and staff who come round with the food and other healthcare professionals were not being protected properly, and I don't want to see that happening again. I would like us to have a discussion with Citizens Advice Bureau so that we can talk about what they have done, what they have learned, and how we can carry on working with the voluntary sector over the next few years. And then, of course, we do need to have a session which will be learning about the costs of COVID-19, where we've actually had, I know that we've got the headline figures, but I think we need to be able to delve into that. So there are quite a few topics there that I think that we should be looking at over the next few months. The costs can wait till much later in the year, because I'm sure that it's going to take quite some time before they start to settle down.
Thank you very much for your some initiatives. We can look this into future. Guy and
yeah. So I've been thinking about this from key lines of inquiry point of view. Now I'm just going to look at the PPE aspect. I mean, what's previously been said is correct. We need data, we need numbers, we need to know what's going on. So aspects that I think we need to cover, just looking at the PPE aspect, because that's, I think, something we can do a lot quicker than some of the other aspects. The stock flow, so basically what's going in and what's going out from the central supply, what the demand is from the care homes and from other providers, GPs, etc. So the requirements and demand aspect, the suppliers themselves, so who we're getting them from, basically what was there, if we can find that information about effectively, and some of this might be public information already, how many masks that were ordered. I know that 3M, for example, had several million orders come in and a manufacturing capacity of a third of that. So the supply and demand equation goes into it. There's also an aspect that I'd like to consider is the voluntary suppliers of PPE. I know for a fact that I myself delivered over 1,500, what were they called? EMC3 masks that we manufactured at work to the Royal Berkshire Hospital for use for ancillary workers in March, as an example. And another aspect is looking at from the Royal Berkshire Hospital that I would like to know and want to question the care commissioning, Health England, etc., is what treatments have basically been put on the back burner, for the lack of better description, because of the COVID-19 issues. Because I'm really concerned that a lot of cancer treatments that were previously, well, not treatments, but cancer screening services, etc., appear to have fallen by the wayside, along with other support aspects of the NHS, which is preventative in nature. And that aspect really concerns me, because if you miss a 6 month, well, let's take if you're in a high risk category and you need a scan every 12 months, if that's been delayed by 4, 5, 6 months and something's caught, what is the consequences for that? That is what really concerns me now, because we could be in a situation where, because of what this virus is and how common it is, we could have to live with it like the common cold and like flu, like influenza. So we need to know what has happened in regards to that. I know that's a long list, but it's very much trying to set the lines and trying to get each individual points about where we can do things. But there's a lot of aspects that we need to look forward to, not only looking back at what happened, but also taking the forward approach, especially around that cancer treatment element as an example. Thank you, Guy. Very important topics you raise. I hope Madeline starts making a note of us.
Very good.
Yeah,
Very
thank you.
Point.
Right, definitely. Malcolm, Richard, and then Adrian.
Right, thank you, Chairman. Yes, I had my hand up a while ago, but someone kept taking it down. Anyway, my concerns equally are about the key lines of inquiry. We've obviously raised a number of subjects during this particular session today, and on the basis of some of those, we've found a few I think we ought to be questioning. And as Guy has already just said, he's interested in the impact that this has had on other things. So not only about PPE, but what getting the stats quickly, how accurate they are, what are the impact been of when you move people off their normal job onto COVID, what impact does that have elsewhere, or vice versa. So a lot of key lines of inquiry, because COVID-19 is still here, even if it's declining at the moment, it's still here. We need to make sure we're looking at it and that the system is working all the way until the end of it. So key lines of inquiry in various areas. That's basically my concern. Much the same, basically, I suppose, as Guy mentioned earlier. Thank you. My hand is now down again, fine, with my approval.
Thank you. Is it Rachel next? Rachel Bishop, yes. Hello.
Sorry, I hadn't unmuted myself properly there. Can one of the things that we look at be mental health? Because a lot of people are saying that we're likely to have a mental health crisis as a result of both what has happened with COVID and then the economic follow-on.
Could I just interrupt there, Chairman?
Yes.
Because Councillor Bishop's first question is the management committee agreed that I think that mental health was going to be looked at by one of the other committees and health scrutiny would be invited.
Exactly.
So just to kind of make you aware that it is on the radar.
Yes, Madeline, if my memory is correct on that, it was basically children. It's going to children, and we're going along as well. So
brilliant, thank you.
Okay.
Well, I think children's, as chairman of Children's Overview and Scrutiny, I think we'd be happy to welcome any of the scrutiny panels to come along.
Okay, so that's in order then. Thank you very much for that. Adrian.
Thank you, Abdul. It's a long time, I know, but the last HOSC meeting we had, we talked about the lack of capital expenditure at Royal Berks Hospital, specifically the buildings falling down and the site being, lack of parking, drop-off points, all sorts of other things. But one of the things that this COVID time brings to the fore is, capacity constraints. Have they got the right buildings? Are the right buildings in the right places? Are they, do they have the budget to do things? So I'm very interested in what the RBH Trust and the CCG have to say about this, their capacity and robustness and their resilience for if there's another pandemic or another outbreak or other issues. So I would, in terms of Madeline, I would definitely like briefings from the NHS Trust and the CCG, i.e. full reports, so then we can have meetings scheduled after that and we can get some oversight of what they're doing.
Thank you. Madeline, do you want to, I just want to come to end, so I'm sure you have made some, somebody put their hands up. Nicholas. Dermot. Hi, Nicholas. Do you want to go?
Yeah, just in response to that last question,
Rollbacks.
just informing council, I don't know if they know, but RBH were in receipt of government funding to at least produce plans for either a hospital rebuild on site or elsewhere. We've just heard about this, so the 3 Health Watch in the West, so us, Reading and West Berkshire, are having meetings with the company that's been given the job to do the engagement called Freshwater. We're speaking with them tomorrow, and I'll feed back to the HOSC, and that's specifically around engagement and ensuring that the people of Wokingham are engaged properly with about those plans for RBH.
Thank you for your update. Madeline?
Apologies. I was just going to make the suggestion, if members are happy, that obviously taking on board all the members' comments, that perhaps I go away and try to put together a sort of timetable for further scrutiny of the care homes, and obviously from the health issues that you've raised, which was also delegated from the management committee, put together a sort of timetable and talk to officers and see what would be possible and circulate it to committee and see whether you would be happy or whether you have anything to add to it. So just wanted members' views on that suggestion.
All right.
That sounds great to me.
It's okay with me.
Yes, that sounds great.
Thank you. Anybody else got any objection or any?
Not an objection, Abdul. I think it would be, Guy's mentioned a few things of data that he'd like. I've got a few ideas. Can we just send those to Madeline so we can include it as like an appendix to that timescales as well?
Please do.
Good idea, Jim.
Thank you. Right, I'm conscious of time now. So can we come to this, can we agree to note the presentation of that we agree?
Sorry, Abdul, can I just ask one very short question?
Is that, make it very quick because we only got the health watches.
This is to Neil Carr actually, because Neil Carr had the idea of distributing some kind of questionnaire or something to the residents, so we get some information from the residents. And I think that was Nicholas Durnham's point about gathering information, which I would be strongly advocating that we find out what's going on for the residents.
Okay, thank you.
Sorry, Adrian, are you suggesting that Health Watch may do that? Because I mean they've done excellent work in speaking to people and recording their stories and their experiences.
I'm not sure whether it's Health Watch or something from WBC. Perhaps Neil could comment.
Go on then, Neil. Do you want to come in?
Yes, that is in hand. So we're going to be doing shortly a call for evidence to asking residents and anybody in the borough what they think about the council's handling of the pandemic. I've already written to town and parish councils. So the aim is to get as much evidence as we can. Because obviously the council will give you evidence, but it's about getting the perspectives from other bodies as well, so you can actually balance that and come to your conclusions.
So Neil, are you just writing to parish council? How about the voluntary organisation or citizen advice bureau? I mean, all the people we work with?
Yeah, the plan is to write to as wide a variety of bodies and sectors as possible.
Okay, thank you.
Does that help, Nick?
Nick probably will
Is that
give
a
us.
question for me, Nick Durman?
Yes, it is. Yeah.
Yeah. What I would say is that, and if we got the chance, I was going to give just a quick overview. All of the Health Watch in the area made the decision, and there's currently a project with the CQC and Health Watch England to carry out surveys in their local population, saying because we care, and that came out of a survey in London that identified lots of people willing to give their feedback about NHS services because we care about them, and feedback is good. So across the West, we've carried out individual surveys, but they're going to be pulled together as a West document, but we'll also produce one for Wokingham. We've currently had 180 responses, but that was more focused at what was your experience of NHS services? What was your experience of being able to find the information you need about local services? And that wasn't just the NHS, it was about social care, shielding, advice about dentists, GP services. And that's going to run to the end of this week, and then we're going to pull it together and publish a report.
Thanks a lot.
Right. Anybody else indicating? I couldn't. Madeline, is there anybody else? I couldn't see anybody else's hand. So can we? Okay, thank you, Madeline. So can we come to end of this agenda to make a note of this presentation? Can I have your show of your hands, or do you agree? Thank you, everybody. Oh, make sure you take it down once. Right. Thank you very much, everybody.
Thank you, Abdul.
You're welcome. Thank you, Alison.
Thank you, Abdul, for that.
I hope you enjoyed it, Abdul. You look very relaxed in the chair.
It's the people I work with. I have wonderful officers and very intelligent, committee members who's looking after our residents.
Chairman, the next item is Health Watch report.
Yes. Can we move into Health Watch report, please? Can I ask Jim and Nick to present the report?
Yes. Thank you, Chair. I'll keep it very brief. Hopefully, you've had the chance to at least have a look at the annual report. If you have, you'll notice that I'm not wearing a very loud shirt as I do on the chairman's introduction. But I am very conscious of the time, so I really am going to let Nick talk to it and invite you just to ask any questions that you have. But I'd also recommend commend the work that we're currently finalising on perinatal mental health report, which we're going to be publishing soon, which is focused on mental health needs of new parents. So whilst obviously we're very concerned about everything apropos of COVID-19, that too is going to play into all sorts of other areas as well. As I say, I really don't want to take up too much time. Nick, is there anything you particularly would like to highlight in the annual report? And then let's just enable anyone to ask any questions on it.
Up to you. Over to you, Nick.
Yeah, just unmute myself. Here we go. I think because of the time, perhaps the best thing to do is invite questions about the impact and outcome report or about the annual report. But I thought what I would do, based on the time, was try and just give you a summary of what we're seeing from the survey that I was talking about. If everyone's happy about that.
Yeah, seems okay.
Yeah.
Yeah.
Is everyone content with that?
Yes.
Yeah, that's okay.
Yeah.
I'll still have a couple of questions.
Do you want?
You ask those. Why? I've lost it now. I've got to go and find it. So you ask the questions while I try.
Right.
Okay.
Okay. So
hold on, Clive. Let me see how many people wanted to ask questions, given the time. Anybody else wants any? So far, no indication. So you carry on if they think about it. Go ahead.
Yeah. Okay. All right. So does Health Watch have the necessary budget to fulfil its work in the year 2021? And what more would they have done if there hadn't been an 11% cut in the budget?
I'll defer to Jim on that one, if I may.
Yeah, common stalking horse for us, of course, Clive. The answer is, in many respects, we have to say, do you know, we don't know what more we could have done because we never had the opportunity to. We'd have probably done a lot more on developing a volunteer network, and we'd have been able to do more interim views, attendance at and involvement in more organisational meetings of other parties outside of Healthwatch. I mean, as you'll be aware, there are so many bodies involved in health and social care in our area, and to seek to be an active voice all the time across all of those is really one of our biggest challenges. We would probably have been able to have recruited sooner the current staffing that we now have. You'll be aware we've got a Healthwatch lead, which again is only a day and a half a week. We've also got another Healthwatch officer, but again, that is only, I think, is about a day and a half a week. Now, both of those people, and especially the Joanna Dixon, who's working with Nick at the moment, doing really valuable work, and despite all the circumstances, currently reaching out into various all the communities, but we are constrained by our people, or not having enough resource people to put feet on the ground to do more in terms of social media, to do more in terms of any form of communication. And obviously we've lost the opportunity for face-to-face this year for pretty obvious reasons. We've been lucky that we've been able to maintain the alternative, such as we're doing now. But and I don't want to back away from saying, well, if we'd have had that extra 11%, we'd have done that. Do you know what? We'd have probably unearthed other things we should be investigating. Our prioritising would have been different.
Yeah.
And I think you sat in enough meetings where we said our priorities now are determined by what resource we've got to apply to it that enables us to fund it. And that is, I think our very small organisation punches way above its weight. And we're very lucky that we've got more than just competent people involved with us, not just staff, but also the volunteers who put in time. But nonetheless, if we'd have had more full-time staff, we could have done a lot more.
Yeah.
And I really can't say any more than that.
Okay. Are you going to be able to do any report over the next 6 months as to what our residents have thought about how they have been dealt with by all sorts of health agencies during the pandemic?
Yeah, I mean, the very short answer to that is yes. And again, Nick, I think, has started to speak to that, where indeed it's how people who are using the services during the current situation, what their feeling is. And that's part of the survey, which Nick was alluding to, 180 plus responses. And I know there are one or two, I'm just trying to see if the headlines. There was actually praise for some of the surgeries as well. Do you want to comment on that, Nick?
Yeah, perhaps I can just quickly summarise what we're hearing so far. But I would just say before that, I know time's short, that we've had to change the way we work. We can't engage in the way that we did, so it's had to be very web-based, advice and information, social media. And one of the things we banged on about in the past is digital exclusion, and now we're part of the problem too, because it's the only way we can engage. But anyway, so like the headline themes are being praised for a lot of the surgeries. People didn't want to bother health or care services while they were busy with COVID. Other people thought their problem could wait until services were back to normal. And if you do have any questions about this or the impact and outcomes or the annual report, pass them on to Madeline. I'm quite happy to get back to you with answers. The other things people had difficulty with, accessing information about changes to dentist services. The dental stuff was awful. Other things people had difficulty with was accessing information about changes to GP services, also accessing information about how can I look after my mental health and well-being. And I did add a bit on the chat that I really do think it'd be worthwhile the HOSC inviting Berkshire Healthcare Foundation Trust to come in and talk about Prospect Park Hospital, particularly going forward, because they're going to be under severe pressure with the emerging mental health problems. So they were the key things so far that we're seeing. There's the one other one was around information for people with learning disabilities, or those groups that are disproportionately affected. So we've all heard about, you know, BAME, but Healthwatch sit in on the CLASP adult learning disability group. And we've had to field a lot of questions from them about not being able to find the right information on the RBH website because it's not in easy read. And we've raised that several times in the meetings we've had with the CCG and Royal Berks Hospital. Awful things like Morrison's Pharmacy deciding en bloc to cancel all their Nomad packs for all of their patients, despite the advice from the overarching pharmacy body that yes, they could review, but if they were going to remove a Nomad pack from someone who was vulnerable, they had to go through a certain process, an equality assessment. And I've written to them twice asking if they went through that process as they were told to do, with no response. So the only option we have now is to raise it as an official complaint with the Ombudsman. So you've got all those types of issues going on. I'm aware of the time, so I'll finish there.
Thank you, Nick. Thank you so much. And Jim, I can see there's two other members want to speak, but I'm sure.
Yeah, sorry.
Madeline, just a moment, Jim. So we got dentists, Prospect Park, pharmacies. I'm sure Madeline's got some notes for me later on. Jim, go ahead, quickly as possible.
I got three quick questions. First one is, when can we see a copy of the report on mental health? Second question is there anything you want from this scrutiny team to help you look at going forward? And the third question is, where did you get that shirt?
Thank you. We'll make a note of that.
Do you want me to answer those questions?
Do you want to hear Adrian's as well, so you can answer in one go?
Yes. Yeah, when will we get the report, and what would you like from us?
I can answer the report one. You'll get it within the next 3 or 4 weeks.
And as far as what support we would like from the HOSC, it continues to be the same. We look to you as councillors to support Healthwatch and to, if you like, beat our drum. I don't want to be, you know, too cliched about this, but there are, I don't know what we reckon our population is at the moment in Woking Borough, 168, 169, it doesn't matter. But everybody ostensibly is really in the Healthwatch ambit. And you, as far as we're concerned, we see you as volunteers as well. Please bring us information that we can follow up, that we can that we can check against what we hear, and please be a voice for what we're doing. I'm not going to be as, yeah, I'll stop there. And by the way, I can't remember where that shirt came from, but I've got a ton of them.
Thank you. Neil, do you want to come? Neil Carr? Neil, I think you've indicated to speak.
I think Adrian has.
Adrian, do you want to go ahead?
Yeah. Firstly, thanks a lot to all the Health Watch guys. We really appreciate the information that you gather and everything. One of the things on, I think it's page 5, is talking about pickups and drop-offs. This has been mentioned in previous HOSP meetings, specifically by Jim Fruin, in relation to the Royal Berks Hospital. A question from my side is: do you survey residents or anyone around this specific topic, which seems to be one of the main topics that arises? Because for us as a HOSP, we want to find out what the residents are feeling, and anecdotally we would say there are issues with parking and pickups and drop-offs. But have you got any data on it?
Are you talking about the Royal Berkshire Hospital?
Yeah.
No, we don't have any specific data on that, but it's something we can raise with the meeting tomorrow that we're having with Freshwater, who are doing the engagement about the rebuild of Royal Berks Hospital, because when they sent us through their draft paperwork about the type of engagement they were doing, the one thing I raised was that there's nothing on there about transport or car parking.
Sorry, can I ask, if it's possible to forward any documentation in relation to that organisation and what they're doing, what their remit is, and what they might end up doing? That would be really helpful.
I've made a note, Adrian. As soon as you asked it, I made a note, forward on the documentation, so I'll do that.
Thank you very much.
Adrian, I would also say that this theme has been a constant. I mean, and I know if Tony Lloyd still sat there, I'm sure he would answer to the same. Certainly for the last 7 years of our existence, and we have continued to pursue this over these years, including meetings with facilities management and property, etc., and looking to see if we could broker anything. We have had some small successes, and for a while we were also using some of the volunteer drivers to try and harvest stories for us. And of course, they are very often it's the volunteer drivers who provided us with the most information over the years, because they took so many people to the RBH, couldn't get parked, etc., etc., etc. But we probably could dig out one of our very first reports on transport, which I think we published in about 2014.
That would be helpful also, thank you.
Yeah, we'll see if we can dig it out of the dusty archives.
Jim, can I also ask you, car parking has been an issue for many, many years, subject to Reading Borough Council not giving planning permission to build more. So our resident has been suffering a lot. So if you could please kindly look into that in more details and report back to us, we'll be most grateful.
Well, whatever we can acquire, but we can put it on our list of things to pursue, and we can see where we go with that. Maybe that's when we do start coming back to the HOSP and asking for some more support. Okay.
Thank you. Neil? Neil, do you want to come back? Neil Carr?
No, I haven't raised my hand, Abdul.
Okay. Thank you very much then. Then my thank you to Jim, Nick, for your well-presented reports in this sort of pandemic situation. But thank you. It's very much so understandable, and we thank you for all your hard works. Thank you, Jim.
Thank you for your support too.
So, members, can we agree to note the presentation they made?
Yes.
Thank you, Guy. Thank you. Right, then that's been noted. Thank you so much. Thank you. Can we go into our next agenda item 11, forward program?
Abdul, I actually wanted to make a comment about the forward program. If this freshwater company is going to be really involved in the decision or possible decisions that we're talking about, can we ask them to present what they're thinking?
I can ask our Madeline to look into that and see if we have. I'm sure as a local authority we will have some input in it. Can I ask Madeline to come in, please?
We'll look in to see whether that would be possible.
All right, thank you, Madeline. Right. So for the following, to agree the following forward program, if there is any agreement that what we have spoken, then we'll, Madeline, do you want to come in just to give us a?
Yes. Obviously, you've had a lot of discussions of issues that you want to look at in the future. Other than putting those to one side, is there anything else which members feel should be on the forward programme going forward?
Open to members.
Because, sorry, can I talk?
Yes, go ahead then, Adrian.
Because so many people are saying that dentistry is a problem, how could we possibly get a view on dentistry? Because these are all private organisations. Is there anything we can think of?
You could invite the commissioners of the dentistry service, and we have in fact had them to HOSC in previous years, so you could do that to get a better picture.
Would the other members of the HOSC think that's a good idea or not?
Adrian, let me come on that. I've been in this meeting, similar meeting for the last 10-15 years. Whether it's Wellbucks Hospital or any CCG, NHS England, we can write to them and up to their discretion to come in. And we have invited previous years, all these people came in, whether it's dentists or pharmacies problems and etc. So yes, I fully agree and will support this. Any other member want to comment on that?
I would definitely, Councillor Malcolm Richards here.
Okay.
I would definitely like dentists to come in and tell us why they're doing what they're doing at the moment. I know they've been out of circulation as pretty well everybody else, but would I manage to bang on the door to speak to my dentist? He said, "Oh, we've got 6 to 7 months before we can catch up what we haven't done since the start, before we can even do any checkups or anything, and emergencies have to be real emergencies." That means we're effectively almost without a dental service during that time. I think it definitely would help to have someone come along, explain what, how they're working, what they're doing to catch up.
Okay, Jim.
I think if we come back to where we were with COVID, I think it's a good idea to ask both the dentists and the pharmacy organisations to come and talk to us, because they've been impacted by COVID as well. If we're going to find a way forward when we go with the next phases of COVID, I think it should be part of that review.
Thank you. Anybody else wants to come in?
I think it's a good idea from Jim about the pharmacists as well. I mean, that information about Morrison's is very disappointing.
It is disappointed. Right. Thank you, Adrian. Madeline. So you probably got everything we've been talking about, more or less, the most. Do you want to come in and give us the overall where we are?
So what I propose to do is take away all the comments that you've made across the meeting. In terms of the COVID review, I will put together a proposed timetable, discuss it with officers and send it to members for your agreement, and obviously to let me know if I've missed anything. And obviously I will try to reflect that in the forward programme going forward as well.
Right. Is members, everyone content with what she just given us, the summary of it?
Yes.
Yeah, go for it, Madeline. Yeah.
Yep.
And we'll try to send you some stuff to help with that, Madeline, as well.
Okay. Thank you so much indeed. Well, members, thank you so much. I'm sorry it's been a little bit late, but thank you for your support, and I hope you enjoyed the rest of the evening. I can ask the meeting to be closed now.
Thank you very much,
Thank you,
Abdul.
Abdul.
And everyone else. Cheers. Good night.
Thank you. Good night,
Thanks,
everyone.
Abdul. Good night, everyone.
Thank you.